Assalamu alaikum. Today we are going to discuss about the cardiology medicine. I will discuss in this video about the standard 12 lead ECG. So first of all, let me tell you what is ECG. ECG is an abbreviation of electrocardiogram. An electrocardiogram is actually a recording of the heart's electrical activity. As you know that our heart has two types of activity. One activity is mechanical activity and the other activity is electrical activity, right? What these two activities do, what are these functions of these two activities? Mechanical activity is actually responsible for making the heart contract. It causes the heart to contract, like your heart contracts and then blood is pumped to the whole body. So this is the function of your mechanical heart's activity or heart's mechanical activity. And after that there is the electrical activity. Mainly this, due to this electrical activity, the heart initiates and transmits the impulses. Like here a heart is shown in front of you, and you can say, you must have read it in your previous years, that what is the electrical activity of the heart, or how the activity of the heart is going on. What the heart do is actually the result of its electrical activity. An impulse is generated and it then spreads into your whole heart, and due to which your heart actually contracts. So let us discuss about that electrical activity. This electrical activity is initiated or generated by your pacemaker of the heart, that is SA node, and from here it goes into the internodal pathways. From internodal pathways it goes into this AV node, and from this AV node it actually goes into the bundle of His, right? From this bundle of His it goes into the right bundle branch, left bundle branch, and from right and left bundle branch it goes into the Purkinje fibers, right, on both sides. And from these Purkinje fibers it actually spreads into this whole ventricle. I hope so this will be clear now. Okay, so this is the electrical system of the heart. So we have the ECG, we do the ECG in order to record this electrical activity of the heart. The heart's activity is actually detected by some adhesive electrodes. You must have seen those electrodes as well. What are the electrodes? There are two things that you must know the difference between these two. You must know the difference between the electrodes, and number two are leads. Okay, leads are nothing but the graphical representation. You must have seen the ECG paper, and the graphical representation or the graphical representation of the electrical activity of the heart that can be seen is actually leads. Okay, these are actually leads. And what are electrodes? Electrodes are actually plastic made adhesive material, or we can say that these are small plastic patches that attach to the skin, and they are placed at certain spots on the chest, arms and legs as well. I will show you later. These electrodes are then connected to the ECG machine, and the electrical activity from your heart is then measured, interpreted and printed out by this ECG machine, right? Okay, so, and the resulting measurements, the measurements we have taken resultantly are referred to as the leads, right? Okay, so now there is another interesting topic, that what is the basic or basics of recording electrical activity, how an electrical meter and electrode works. It is very much interesting, and it is actually responsible for the major concept hidden behind this is actually responsible for making the ECG paper as ECG paper, or making ECG paper as it is shown. Like you have seen ECG paper, or you have must seen the normal electrical activity P wave, or after that you have seen the Q wave, R, S and T waves. Okay, you have seen all these things. And why this P wave is upward, this uh, zero or basic line, and why it goes down this basic line or zero line. And some waves, if you have seen the ECG, you must know that some waves are shown below this baseline. Why is it so? It is actually the concept hidden behind is in the basics of recording electrical activity, but this is not our video's topic, so we will stick to the topic mainly. I will try to make another video in which I will show you the basics of electrical activity. So अभी तक हमने क्या डिस्कस किया कि इलेक्ट्रिकल सिस्टम ऑफ द हार्ट, हमारे हार्ट की दो एक्टिविटीज़ होती हैं, एक मैकेनिकल एक्टिविटी और एक इलेक्ट्रिकल एक्टिविटी। इलेक्ट्रिकल एक्टिविटी क्या होती है, जो कि मैंने आपको बता दी कि किस तरह से इम्पल्सेस जनरेट होती हैं और कैसे फिर वो जो है वो आपके पूरे हार्ट में रन करती हैं। इस इलेक्ट्रिकल एक्टिविटी ऑफ द हार्ट को रिकॉर्ड किया जाता है वाया ईसीजी, एंड दिस ईसीजी is then connected, and then this ECG is mainly recorded by the ECG machine. Electrodes, the basic thing, first basic thing is the electrodes को आप प्लेस करते हैं। उन इलेक्ट्रोड्स का काम ये होता है कि इलेक्ट्रिकल एक्टिविटी को रिकॉर्ड करें। कैसे रिकॉर्ड करेंगे, क्योंकि हमने इन इलेक्ट्रोड्स को फर्दर एक ईसीजी मशीन के साथ जो है वो कनेक्ट किया होता है। वो जो ईसीजी मशीन है वो क्या करती है कि वो इंटरप्रेट करती है, मेजर करती है और प्रिंट आउट कर देती है हमारा ईसीजी पेपर, राइट। Okay, so let's move towards the 12 standard 12 lead ECG, the major topic or main topic of our video. So in 12 lead ECG, here are limb leads, augmented leads, and precordial leads, or we can also say that these are the chest leads. Mainly, if you want to see the heart, you can see it by two views. Like if you cut the heart into anterior and posterior halves, okay, like frontal view. You must know frontal view. What is the frontal view? If this is your body, okay, if this is your body, and you cut it into anterior and posterior halves, okay, then this will be the frontal plane. And there is an other plane by which we can see the heart, that is the transverse or axial view, like this, which runs in this plane. Okay, so we will try to understand that you can see the transverse or axial view of the heart by which leads, and by which leads you can see the frontal view or axial view, I'm sorry, frontal or coronal view of the heart, and by which view you can see the transverse or axial view of the heart. Mainly in limb leads, the limb leads I will discuss later. Limb leads and augmented leads, both these are responsible for showing the heart in the coronal or frontal plane. But the chest leads or precordial leads are responsible for making us to look the heart in the transverse or axial plane. Okay. One more thing I want to mention here is that the purpose of this 12 lead ECG, the standard 12 lead ECG, the major topic of our video, the standard 12 lead ECG. What is the purpose of this 12 lead ECG? What does mean by 12 lead ECG? Actually, these 12 lead ECG means that here are some views of the heart. Okay, mainly we see 12 views of the heart. 12 lead ECG का मतलब क्या है कि हम इस 12 lead ECG की मदद से हार्ट, अपने हार्ट के 12 व्यूज से देखते हैं, इंफीरियर व्यू से, लैटरल व्यू से, अबव से, कैसे देखते हैं, इन लीड्स की मदद से देखते हैं। ठीक है, सो 12 लीड्स, बाय दीज 12 लीड्स 12 views of the heart are seen. Okay, so let's move towards the limb leads. First of all,